One Health. What is One Health? Because that's a thing in your world, right? What is One Health, John?
Yeah, I mean, this is a really important, point, and One Health is essentially recognizing that human, animal, and ecosystem health are all interdependent. I mean, that's, I'd say, the fundamental tenet of the One Health concept. And, again, One Health is something that has been on the agenda and recognized as a priority for quite some time. And now, of course, has been really, I'd say, reinvigorated due to the COVID situation. But it has to be, prioritized. We need to continue.
Okay, so John, are you up for sitting in a basement again in 5 years' time for 18 months? I'm like not up.
I hope not. I hope not.
You're not up for that either, right? Okay. So if no one's, I'm going to ask, we could have a little survey. Is anyone up for doing this 5 years from now for the next funny name disease and sit in our basements and Zoom at each other for 18 months while we wait till we find another vaccine? If we don't want to do this again, and I'm up for not doing this again, then we got to deal with this One Health stuff. All this stuff, zoonotic diseases means if we don't deal with zoonotic diseases, we're sitting in our basements again in 5 years' time. That's what this means.
As it goes to wet markets and the issue of wildlife trade, it's not as simple as banning wildlife trade. I mean, there's a whole set of, unintended consequences that I think, present themselves as a result of that. So, I think that we need to focus on, regulations and enforcement. And
that's something AID could do, right, John? I mean, this is something, This is right up AID's alley. So One Health, managing ecosystems, supporting, managing forests, planning, urban planning, super non-glamorous stuff, but really important stuff to make sure that you have development, or the kinds of things you're describing, like regulating wet markets or going after and dealing with issues around illegal animal trade. These are all things where there's an undergird of stuff that AID and AID's ecosystem of partners do to respond to that challenge. Is that correct?
That's correct.
Because we have to get ahead of this in the future. We need to think in security terms about environmental security as a form of national security. And then we need to think about environmental health when we think about global health, right? These are the kinds of concepts that you're trying to tell us. Is that right, John?
Yeah, no, absolutely. I mean, again, getting back to the One Health as an important priority, it's really critical that we no longer treat environmental issues and environmental programming as separate from health.
From everything else.